मिनी कैटजन का पार्ट 5 आज स्टार्ट कर रहा हूं, जिसमें हम डिस्कस करेंगे ड्रग्स विच एक्ट ऑन द नर्वस सिस्टम। और इस सीक्वेंस का पहला चैप्टर है, चैप्टर नंबर 21 है मिनी कैटजन का, एंड इट टॉक्स अबाउट द इंट्रोडक्शन टू सीएनएस फार्माकोलॉजी। जैसे जब कोई सेक्शन हम स्टार्ट करते हैं फार्माकोलॉजी का, तो पहला चैप्टर ऑब्वियसली उसके इंट्रोडक्शन से रिलेटेड होता है। फिर आगे ऑब्वियसली वी आर गोइंग टू एक्सप्लोर द चैप्टर इन फुल डिटेल, जिसमें हम एंटी साइकोटिक्स, एंटी डिप्रेसेंट्स और जो भी ड्रग्स नर्वस सिस्टम पे काम करती है, सीएनएस पे पर्टिकुलरली, उनके बारे में डिस्कस करेंगे। So let's start the introductory chapter today, okay? Targets of CNS drug action. Drugs that act on the central nervous system are most commonly prescribed drugs in the current use. So here's the catch, these are amongst the most commonly prescribed drugs. Most of these drugs act by changing the ion flow through the transmembrane channel of the nerve cells, and this is why it is also very important to first understand the physiology of the nervous system के कौन से ions neurons के across travel करते हैं, सोडियम, पोटेशियम, कैल्शियम, और न्यूरोट्रांसमीटर अपटेक मैकेनिज्म्स क्या है। सो ज्यादातर ड्रग्स जो हैं वो ऑब्वियसली इसी आयन फ्लो को मैनेज करती हैं, इसको ऑल्टर करती हैं। ट्रांसमीटर रीअपटेक ट्रांसपोर्ट जिन प्रोटीन्स के जरिए होता है, दे ऑल्सो आर वेरी इंपॉर्टेंट क्लास ऑफ ड्रग्स, उनको भी टारगेट किया जाता है। पर्टिकुलरली एंटी डिप्रेसेंट्स जब हम डिस्कस करेंगे तब इस मैकेनिज्म ऑफ एक्शन का जिक्र आएगा। देन इनहिबिशन ऑफ एसिटाइलकोलिन मेटाबॉलिज्म इज वन ऑफ द मेजर ड्रग्स करंटली अप्रूव्ड फॉर अल्जाइमर, which is another very prevalent disease, particularly in the western countries जहां life expectancy बहुत ज्यादा है। So this is one of the very very prevalent disease in old age, Alzheimer. And then GABA metabolism is inhibited by anticonvulsants. So you can already begin to have a flavor of what sort of CNS drugs we will be talking about. इसमें अगले चैप्टर्स में आएंगे दोज ड्रग्स जो आयन ट्रांसपोर्ट को अफेक्ट कर रहे हैं, दोज ड्रग्स जो एसिटाइलकोलिन के मेटाबॉलिज्म को अफेक्ट कर रहे हैं, उसके अपटेक को, दोज ड्रग्स जो गाबा मेटाबॉलिज्म को अफेक्ट कर रहे हैं। सो विल डिस्कस all of them in the upcoming videos. Finally, there are few drugs which appear to act by altering the function of the neuroglia, and neuroglia, very well, are the supporting cells of the neuron. So ye tamam that is the preamble to what we are going to do in this section number 5 of mini KATZUNG. अच्छा, आयन चैनल्स कौन कौन से होते हैं? देयर आर टू मेजर टाइप्स ऑफ आयन चैनल्स। अगर हम फंक्शनली उनको क्लासिफाई करें तो वन ऑफ देम इज नोन एज द वोल्टेज गेटेड आयन चैनल एंड द अदर वन इज नोन एज द ligand gated ion channels. You see both of them written here. The voltage gated ion channels respond to changes in the membrane potential, which is what we call the voltage of the ion channel. ये हमने फिजियोलॉजी में बहुत डिटेल में पढ़ रखा है कि सेल के अक्रॉस देयर इज अ पोटेंशियल, एंड दैट पोटेंशियल इज व्हाट वी कॉल द मेम्ब्रेन पोटेंशियल। और ये आयंस की एंट्री, आयंस का एग्जिट इस पोटेंशियल को चेंज करता है। दे आर फाउंड इन हाई कॉन्सेंट्रेशन ऑन द एक्सॉन्स ऑफ नर्व सेल्स एंड इंक्लूड सोडियम चैनल्स रिस्पॉन्सिबल फॉर initiation and propagation of action potential. The cell bodies, axon terminals and dendrites also have voltage sensitive ion channels for sodium, potassium and calcium. यानी पूरे ही न्यूरॉन पर either it is the cell body or the axon or the nerve terminal, सब जगहों पे ये चैनल्स मौजूद हैं जो वोल्टेज की चेंजेस से खुलते और बंद होते हैं। और इनमें सोडियम के चैनल्स हैं, पोटेशियम के और कैल्शियम के। यही तीन मेजर आयंस हैं जो सारी नर्व फिजियोलॉजी में इन्वॉल्व है। Ligand gated ion channels, also called the ionotropic receptors, respond to chemical neurotransmitters that bind to the receptor subunits, और उनकी बाइंडिंग से या तो वो रिसेप्टर खुलते हैं या बंद होते हैं। न्यूरोट्रांसमीटर्स कैन also bind to G protein coupled receptors. So दो तरह की रिसेप्टर्स हैं। One category of receptor works on changes in the ionic potential, आयन का एग्जिट और एंट्री, और दूसरा है कि एक रिसेप्टर होगा, उस पर कोई चीज आकर के बाइंड करेगी, द केमिकल न्यूरोट्रांसमीटर, और इसके बाइंडिंग की वजह से ये चैनल ओपन होगा और आयंस एंटर होंगे। सो ये दो मेजर मैकेनिज्म्स हैं, ठीक है। देन वी ऑल्सो, और ये सारा फिजियोलॉजी का टॉपिक है। मेम्ब्रेन फिजियोलॉजी हमने बहुत डिटेल में डिस्कस की है। सो व्हेन वी वर डूइंग द मेम्ब्रेन फिजियोलॉजी फ्रॉम गाइटन, वी टॉक्ड अबाउट ऑल दीस सॉर्ट ऑफ डिफरेंट receptors and channels also present in other parts of the body and also on the neurons. Now the types of receptor channel coupling. In case of ligand gated ion channel, यानी there is a channel, उस पर कोई ligand आके bind करेगा, in most of the cases it's a chemical neurotransmitter. So when it binds, activation or inactivation is initiated by the interaction between the chemical neurotransmitter and their receptors. Coupling may be through a receptor that acts directly to the channel protein, जिसे हम कहते हैं G protein coupled receptors, or through a receptor to a G protein that modulates the formation of diffusible second messenger. And second messengers can be cyclic AMP, inositol, triphosphate, diacylglycerol. Maybe they have given this somewhere in the diagram. So if you look at the diagram here, so here you see this is the voltage gated channel. It operates by changes in the voltage across the cell membrane. इस तरह से है. और जो ligand gated है उसमें there is a ligand comes and binds to a site or a pocket on the receptor, such as a chemical neurotransmitter. It comes and binds over here. उसकी binding से फिर reaction start होगा. अच्छा, ये जो receptor है, it can also be a G protein coupled receptor. So you see here there is a ligand coming on, and that's a G protein coupled receptor coupled to G proteins, as a result of which we generate second messenger, which can be cyclic AMP, depending upon किस G protein के साथ bind किया है. Again, that's a topic that we discussed in detail during physiology lectures. So this is just to remind you and give you a flavor of how the nervous system, channels and receptors basically operate. Now, role of ion current carried by the channel: excitatory post-synaptic potential. Now, this word looks very long and complicated, but in essence, it is not. So, look here. The excitation means it will happen only when there is depolarization. So when we say excitation, here we mean excitation of neurons, and that will happen by depolarization of neurons. Post-synaptic potentials, EPSPs, excitatory post-synaptic potentials, are usually generated by opening of the sodium or the calcium channels. So when these channels open, sodium enters into the neuron, bringing in the positive charge. In some synapses, similar depolarization potential result from closing of the potassium channel. तो या तो आप सोडियम को अंदर ले आओ या पोटेशियम को बाहर जाने से रोक दो. इन दोनों तरीकों से सेल के अंदर पॉजिटिविटी बढ़ेगी. और ये तो एक्साइटेटरी पोटेंशियल्स थे. जो इनहिबिटरी पोटेंशियल हैं, which are not depolarizing but rather they are hyperpolarizing, they are usually generated by opening of the potassium channel या chloride channel. So potassium gets out or chloride gets in, making the cell more negative. For example, activation of postsynaptic metabotropic receptors increase the efflux of potassium. Again, the basic concepts of depolarization and repolarization and hyperpolarization all are covered in detail in my membrane physiology lectures from Guyton. Okay. Now, sites and mechanism of drug action. Obviously ये introductory chapter है to nervous system. Next chapters में हम एक particular class of drug को pick करके उसकी details पढ़ेंगे. But यहाँ कुछ general principles बता रहे हैं. So in general principles में अगला general principle है site and mechanisms का. A small number of neuropharmacologic drugs. Now neuropharmacologic drugs are the drugs which actually work on the nervous system basically. नाम से ही पता चल रहा है आपको. They exert their effects through direct interaction with molecular components of ion channels or axons. Example include certain anticonvulsants such as phenytoin or carbamazepine, local anesthetics in some drugs, as well as general anesthesia. So, however, the effects of most therapeutically important CNS drugs are exerted mainly at the level of the synapse. So, the point is that they are trying to tell you where exactly the drugs work. Drugs can work directly at the level of axons, for example. Axon. So, this is the cell body. This is the axon. So drugs can go and interact on the axonal level. यहाँ पे channels की permeability को change कर सकती है. But most of the CNS drugs work at the level of the synapse. Synapse में there is the terminal of this neuron, and then there is cell body of the other neuron, or there is an effector end organ. So synapse is the most common site of these drug actions. Okay. Now the possible mechanisms are indicated in figure 21.2, which we will have a look at in a moment. Thus, as noted earlier, drugs may act presynaptically to alter the synthesis, storage, as well as secretion of neurotransmitters. Okay, release and uptake or metabolism of the transmitter chemicals. So, if this is a cell body, that's an axon, and this, for example, is the end organ. तो ये वाला जो एरिया है, this is called the presynaptic. Well, this is synapse. This area is the synaptic area. This is presynaptic. This is postsynaptic. So presynaptic area में न्यूरोट्रांसमीटर बनेगा, स्टोर होगा, रिलीज होगा, उसका रीअपटेक होगा. ये सारी चीजें यहाँ मॉड्यूलेट की जा सकती हैं by many drugs. Other drugs can activate or block the pre as well as the postsynaptic receptors for neurotransmitters. यानी ये न्यूरोट्रांसमीटर निकलेगा, लेकिन जो ड्रग है वो इसके एक्शन को ब्लॉक कर देगी. The selectivity of CNS drug action is largely based on the fact that different groups of neurons use different neurotransmitters. यानी अगर आप एसिटाइल कोलिन इनिबिट करने वाली ड्रग दोगे तो ये सिर्फ उन न्यूरॉन्स को जाके इनिबिट करेगी जो एसिटाइल कोलिन रिलीज करते हैं। उन न्यूरॉन्स पे इसका कोई फर्क नहीं पड़ेगा जो एसिटाइल कोलिन रिलीज ही नहीं करते, और जब एसिटाइल कोलिन रिलीज ही नहीं होगा तो वहां पे उस ड्रग का कोई एक्शन बनता ही नहीं है। सो दे आर वेरी वेरी स्पेसिफिक। ओके, द ड्रग्स दैट ऑल्टर ट्रांसमिटर रीअपटेक are especially important for 5-HT noradrenergic dopaminergic synapses. Serotonin और epinephrine transporters are the targets of antidepressants. ये पैराग्राफ आपको अभी हजम करने में थोड़ी सी मुश्किल इसलिए होगी क्योंकि हम इन तमाम चीजों पर अलग अलग चैप्टर्स पढ़ेंगे। सो अंदाजा करें ना कि there is a designated chapter on antidepressants. There is a designated chapter on so many other classes of drugs. So वो सब इस एक पैराग्राफ में ज़ाहिर नहीं समझ में आएगा. But this is just to give you a flavor. A few neurotoxic substances damage or kill the nerve cells. For example, 1-methyl-4-phenyl 1236 tetrahydropyridine MPTP, मुश्किल नाम है, but anyways that's why you are studying medicine, is cytotoxic to neurons of nigrostriatal dopaminergic pathway. So nigrostriatal pathway, if you remember from neuroanatomy, comes from substantia nigra, which is in the midbrain, and goes to the corpus striatum, which is part of the basal ganglia, and it releases dopamine. So that particular compound is toxic to these neurons. So these are different classes of neurons that you need to know. Here, that's a good diagram actually. I like it. Now here, this is an axon, okay? And this axon is then expanding here. So this is the terminal part of the axon where, the neurotransmitter comes in, synthesized, stored, released, and then reuptake and metabolism होती है उसकी. तो यहाँ इन तमाम points पर drugs act कर सकती हैं. And once it is released, it goes to the post-synaptic membrane. This membrane is known as the post-synaptic membrane. यहाँ पर भी हम ब्लॉक कर सकते हैं न्यूरोट्रांसमीटर के अटैचमेंट को, और फिर अगर एक दफा अटैच हो गया न्यूरोट्रांसमीटर तो वो अपना एक्शन करेगा बाय सेकंड मैसेंजर सिस्टम. ओके, and then the released neurotransmitter is number 1 degraded and number 2 reuptaken. इसके reuptake को भी रोका जा सकता है, इसके degradation को भी रोका जा सकता है. इन तमाम steps को actually drugs के जरिए alter किया जा सकता है, और उस alteration से levels of neurotransmitter will change and the functions will altogether change. Okay? KATZUNG में ये टेबल में हमेशा पढ़ता हूँ हाई यील्ड टर्मिनोलॉजीज का. इसमें वोल्टेज गेटेड आयन चैनल्स जो मैं ऑलरेडी बता चुका हूँ, दीज आर द आयन चैनल्स रेगुलेटेड बाय चेंजेस इन द मेम्ब्रेन पोटेंशियल. देन देयर आर ligand gated ion channels. ये वो चैनल्स हैं जिन पर कोई ligand आके बाइंड करता है. देन देयर metabotropic receptors. These are G protein coupled receptors that respond to neurotransmitters either by a direct action or by coupling to the G protein. So वो receptors जो G proteins के साथ coupled होते हैं, they are called metabotropic receptors. Excitatory postsynaptic potentials. These are the potentials which are because of depolarization of the membrane, and inhibitory are because of hyperpolarization. Synaptic mimicry is the ability of an administered chemical to mimic the action of the natural neurotransmitter. That's why it is called mimicry. It's a mimetic drug, a drug which mimics the action of neurotransmitter. So all these terms you should be very clear about, because पूरे chapter में और पूरी CNS pharmacology में actually कहीं ना कहीं ये terminologies भाई बार बार यूज हो रही होंगी. सो आपको ये इनके बारे में पता होना चाहिए. किधर थे यार हम, पेज किधर गया? That one. Okay. Now the next heading that I have to discuss with you is role of CNS organization. अब CNS के अंदर दो तरह के न्यूरोनल सिस्टम्स हैं बेसिकली. नंबर 1 इज हायरार्कल एंड द अदर वन इज डिफ्यूज. क्या मतलब हुआ इन दो टर्मिनोलॉजीज का? देखिए, हायरार्कल सिस्टम्स का मतलब है they are delimited in their anatomical distribution and generally contain large myelinated rapid conducting fibers. Hierarchical systems control major sensory and motor functions of the body. The major excitatory transmitters in these systems are basically aspartate and glutamate. These systems also include numerous small inhibitory interneurons which utilize GABA, for example. Or wo drugs that affect hierarchical systems have often profound effects on the overall excitability of the CNS. Now let's compare this to the diffuse system. It is non-specific system and broadly distributed with single cell frequently sending branches to many different areas. The axons are fine and branch rapidly to form synapses with many cells. And the transmitters in diffuse system are often small amines, not epinephrine, serotonin, dopamine. Drugs जो इन systems को affect करती हैं, they have marked effects on such CNS functions such as attention, appetite, and emotional status. So these are two different. I mean, that's a way of classifying the nervous output. Hierarchical system is the gross, big distribution, large myelinated fibers, associated with overall excitability, motor functions, all those sort of things. And diffuse system is like one neuron getting to a lot of cells. More associated with attention things, appetite, emotional stuff. Okay, right. So transmitters and the central synapses. Criteria for transmitter status: to be accepted as a neurotransmitter, a candidate chemical must be present in high concentration in the synaptic area than others, be released by the electrical or chemical stimulation, produce the same sort of postsynaptic response that is seen in the physiologic activation of the synapse. क्या मतलब हुआ? देखिए, ये कह रहे हैं कि आप न्यूरो ट्रांसमीटर बेसिकली कहते किसको हैं? अगर ये वाला पिक्चर हम दोबारा, if we go back to this particular diagram, and this is the synaptic cleft, right? That is the synapse, and here this is the synaptic cleft. अगर हम इस synaptic cleft को देखते हैं तो यहाँ पे बहुत सारी चीजें होंगी. से फॉर एग्जांपल यहाँ एसिटाइलकोलिन होगा और बहुत 10 चीजें होंगी. तो उनमें से कौन सा न्यूरो ट्रांसमीटर कैसे पता चलेगा? नंबर 1, वो सबसे ज्यादा अमाउंट में होना चाहिए. नंबर 2, वो प्री सिनेप्टिक एरिया से रिलीज होकर पोस्ट सिनेप्टिक एरिया पे एक्शन उसको परफॉर्म करना चाहिए. सो देयर आर सम क्राइटेरिया फॉर अ केमिकल टू बी आइडेंटिफाइड और डिफाइंड एज अ न्यूरोट्रांसमीटर. तो वो ये क्राइटेरिया यहाँ पे डिस्कस हो रहे हैं. ठीक है. एसिटाइलकोलिन is a famous neurotransmitter. Approximately 5% of the brain neurons have receptors for acetylcholine. Wow, it means it is such an important one to control brain activity. Most CNS responses to acetylcholine are mediated by large family of G protein coupled muscarinic M1 receptors. ये मैंने जब आपको nervous system जब autonomic nervous system particularly हम कर रहे थे तब different types of receptors discuss किए थे. So you should recall from there that acetylcholine mostly works on M1 receptors that lead to slow excitation once they are activated. Ionic mechanism for slow excitation involves a decrease in the membrane permeability to potassium. So basically causing, if this happens, then potassium is not getting leaked out of the cell. And when this does not happen, increase positivity inside the cell, which is what we call the depolarization. Of the nicotinic receptors present in the CNS, those on the Rancho cells activated by motor axon, collaterals in the spinal cord are the best characterized. Drugs affecting the activity of cholinergic system in the brain include acetylcholine esterase inhibitor, and they are used in Alzheimer's disease, examples being rivastigmine, and muscarinic blocking agents such as in Parkinsonism, the benztropine. हम इनके बारे में पढ़ेंगे when we discuss this topic further in the upcoming chapter. Here they are just going to tell you this is an important neurotransmitter. 5% of the brain cells have receptor for them, largely via M1 receptor. So that's kind of the flash things that you must remember about acetylcholine. हर न्यूरोट्रांसमीटर के बारे में कुछ की चीजें आपको पता होनी चाहिए. और जब हम इनके आगे चैप्टर्स पढ़ेंगे प्रोस्पेक्टिवली तो हर एसिटाइलकोलिन की सिंथेसिस, उसका रिलीज, उसका अपटेक, उसका मेटाबॉलिज्म भी थोड़ा थोड़ा डिस्कस करेंगे. ठीक है. यहाँ आपको सिर्फ फ्लेवर दे रहे हैं, आगे डिटेल्स डिस्कस होंगी. देन अनदर neurotransmitter is dopamine. It exerts slow inhibitory action. So acetylcholine shows slow excitatory action. Slow excitation. This is the word here. Slow excitation by acetylcholine and slow inhibition by dopamine. So dopamine is slow inhibitory neurotransmitter. It is commonly associated with G protein coupled activation of potassium channels. So more and more potassium getting out, hyperpolarization of cells. The D2 receptor is the main dopamine subtype in the basal ganglia neurons, widely distributed at the supraspinal level. Dopaminergic pathway include nigrostriatal pathway, again from the midbrain to the corpus striatum, mesolimbic pathway, turbo. So all these pathway we have done in neuroanatomy. These are the distribution basically for dopaminergic receptors. Okay, drugs that block the activity of dopaminergic pathway include older antipsychotics. Older means no more used or seldomly used now, which may cause Parkinsonian symptoms. Drugs that increase the brain dopaminergic activity include CNS stimulants such as amphetamine. ये लिया तो सातवें आसमान पे पहुंच गए type of drugs. Okay, right. Then there is norepinephrine and serotonin. We'll have a word about all of them and then this is all about this chapter particularly. So norepinephrine, noradrenergic neuron cell bodies are mainly located in the brain stems and the lateral tegmental area of the pons. So these are the locations for these cells. These neurons fan out broadly to provide most regions of the CNS with diffuse noradrenergic input. So that's why it is called diffuse. It goes to a lot of different areas of the brain. Excitatory effects are produced by activation of alpha 1 and beta 1 receptors, and inhibitory effects are also there, caused by the activation of two type receptor, alpha 2 and beta 2 receptors. CNS stimulants such as amphetamines, monoamine oxidase inhibitors, and tricyclic antidepressants are examples of drugs that enhance the activity of noradrenergic pathway. So obviously we will discuss them in great detail when these chapters come. Now serotonin, most serotonin, also known as 5-hydroxytryptamine pathway, originate from the cell bodies of the raphe and midline regions of the pons. So pons basically is the region. These pathways innervate most regions of the CNS. They are all very well connected. Multiple 5-HT receptor subtypes have been identified. With the exception of 5-HT3 subtype, all are metabotropic. So they are coupled to the G protein. Okay, 5-HT1A receptor and GABA B receptors share the same potassium channel. There's too much of detail. Even if you don't remember, that's fine. Okay, and we will discuss obviously details of serotonin in the particular chapter. Now glutamic acid, most neurons in the brain are excited by glutamic acid. High concentration of glutamic acid in synaptic vesicle are achieved by vesicular glutamate transporter, V-glut जिसको हम कहते हैं. Both ionotropic and metabotropic, ये हमेशा मेरे से नाम जो है ना फंस जाता है. Metabotropic G-coupled protein receptors have been characterized. There are three major subtypes of glutamate receptors. The N-methyl D-aspartate NMDA receptor, it is blocked by phencyclidine and ketamine as well. And NMDA receptors appear to play a role in synaptic plasticity associated with learning things and memory. So चीजें याद करने में. Memantine is an NMDA antagonist approved for treatment of Alzheimer. अभी ज़ाहिर है ये नाम आप ना भी याद रखें तो that's fine because ये आएंगे Alzheimer की drugs हम पढ़ेंगे. Excessive activation of NMDA receptors after neuronal injury may be responsible for cellular death. ये एक तरह का receptor था for glutamic acid. So that's one category of glutamate receptor. The second category of glutamate receptor is the AMPA receptor, which mediates and excitatory postsynaptic increase in both sodium as well as potassium conductance. An important marine toxin called domoic acid activates the third category, which is known as the kainate receptors. They cause excitatory toxicity. Activation of various glutamate metabotropic receptors can reduce presynaptic calcium conductance, decrease the cyclic AMP level. Well, ये बातें सारी अभी समझ में नहीं आने वाली. जब ये ड्रग्स पढ़ेंगे ग्लूटामिन की तब बात होगी. ठीक है. GABA and glycine. GABA is primary neurotransmitter mediating the inhibitory postsynaptic potentials in neurons of the brain. It is also important in the spinal cord. GABA A and GABA B, ये दो आपको receptors पता होने चाहिए. अगर GABA A receptors activate होते हैं, then they open the chloride channel. GABA B receptors अगर open होते हैं, so they are coupled to G protein and they open potassium channels. This is important information. Drugs that influence GABA A receptor system include sedative hypnotics. Hypnotics पे अलग पूरा chapter आएगा, and there we will talk about these receptors in much more detail, right? And some anticonvulsants as well. Glycine receptors, which are more numerous in the cord, spinal cord obviously, than the brain, they are blocked by styrgine, a spinal convulsant. So again, this bit looks a little difficult. The reason being, आप सारी information यही समझने की और process करने की कोशिश करते हैं. हालांकि you don't have to do this. In this chapter, you just have to take the flavor of how things are going. Okay. Because हर एक पे अलग-अलग डिटेल में चैप्टर आना है. Now peptide transmitters, many peptides have also been. ये तो नाम आपको ये मतलब ये नाम वो है जिसके बगैर आप CNS Pharma और CNS Physiology कर ही नहीं सकते. आपको पता होना चाहिए for sure कि कौन-कौन से neurotransmitters हैं routinely. Acetylcholine, dopamine, GABA, norepinephrine, serotonin, and there are some peptide neurotransmitters as well. Okay. The best defined peptide neurotransmitters are the opioid categories such as beta endorphin, enkephalins, dynorphins, which are distributed at all levels of neuronal axis. Some of the important therapeutic action of opioid analgesics, such as morphine, routinely used, are mediated via activation of receptors for these endogenous peptides. Another substance called the substance P is a mediator of slow excitatory postsynaptic potentials in the neurons. And orexins are peptides which are associated with sleep wake cycling. Well, difficult thing to process at the moment, so अभी के लिए छोड़ें इसको, बाद में पढ़ेंगे. Then endocannabinoids, ये क्या चीज है भाई? They are widely distributed brain lipid derivatives that bind to the receptor for cannabinoids found in marijuana. Routine used compounds जो addiction के लिए भी use होता है. They are synthesized and released postsynaptically after the membrane depolarization but diffuses backward in a retrograde fashion, acting presynaptically to decrease the transmitter release. So release होते हैं synapse में, फिर वापस reuptake होके reverse action. ठीक है? Other transmitters include histamine, nitric oxide, purines, and there are so many other compounds identified as neurotransmitters. Okay, so basically you now have a flavor of what we will be talking about in the CNS pharmacology. This table looks a little important to me because it very nicely tells you अगर आपको फाइनल लास्ट मिनट पर चीजें रिवाइज करनी है, सो यहाँ इन्होंने न्यूरोट्रांसमीटर के नाम दिए हुए हैं: एसिटाइलकोलिन, डोपा, नोरापिनेफ्रिन, सेरोटोनिन, गाबा, glutamate and aspartate, glycine and other peptides. So you have the name in the first column, then the anatomical distribution. Which one is released where? So acetylcholine कहाँ release हो रहा है, dopamine कहाँ largely release हो रहा है, and what are the receptor subtypes known? So acetylcholine, for example, are M1 receptors, M2 receptors, nicotinic receptors. Dopamine के D1 and D2 receptors हैं. Norepinephrine के alpha 1, alpha 2, beta 1 and beta 2 receptors. Serotonin के different categories of receptors. GABA के A and B different types of receptors. So very important chart. And then what is the mechanism? So whatever you just discussed in the text is very nicely summarized in this table. So acetylcholine, for example, working on the muscarinic receptor, one category, they are excitatory. So they decrease the potassium conductance. पोटेशियम नहीं निकलता सेल से बाहर, increase inositol triphosphate and diacylglycerol. So in one glance you have all the information. So if I have to look at कि जनाब GABA A और GABA B किस तरह काम करते हैं, so GABA A is inhibitory type of receptor and it works by increasing chloride conductance, and GABA B is inhibitory. It decreases calcium conductance. So calcium नहीं enter होगा, neurotransmitter release नहीं होगा, inhibitory. It works on the presynaptic as well as postsynaptic. Presynaptic पे ये calcium conductance को change करता है GABA B receptor, जबकि postsynaptically synapse के दूसरी तरफ it increases potassium conductance. So दोनों ही सूरत में सेल का अंदर ज्यादा नेगेटिव होगा, हाइपरपोलराइज होगा, इनिबिशन होगा. So I would recommend going through this particular table in great detail so that you try to understand and memorize mechanism of action of different neurotransmitters. So that is all about this introductory chapter. More to come. The nervous system drugs are extremely important, guys, and you must master them. So आपसे मिलता हूँ बहुत जल्द अगली किसी फार्माकोलॉजी सेक्शन 5 की वीडियो में. तब तक के लिए अपना ख्याल रखिएगा.